Hello, my dear doctor. Right, I'd like to discuss now an important topic that is called Churg Strauss Syndrome. So, what is written in your notes? Just follow me. The Churg Strauss Syndrome is an ANCA-associated small vessel vasculitis. So, features are asthma, then blood eosinophilia greater than 10%, and Paranasal sinusitis, and Mononeuritis multiplex, and Panca positive in 60% cases, and leukotriene receptor blockers may precipitate in the disease. So Churg Strauss syndrome is really an important disorder, and this is associated strongly with the bronchial asthma. So before going to the bronchial asthma altogether, and the bronchial asthma strongly associated disorders that I'd like to go, and then after the Churg Strauss syndrome. All right, let's see the discussion and look at the board. That will be helpful. All right. So, my dear, listen very carefully. The bronchial asthma, SS box. I'm saying the bronchial asthma strongly associated disorders. If I'm writing associations, strongly associated disorders are, and mnemonics that will be helpful, that is CGPA. So people are getting the CGPA gradings, all right? So we can write and to remember altogether bronchial asthma strongly associated disorders are CGPA, right? So make a box. What does this CGPA really means? CGPA, all right? C stands on the Churg Strauss syndrome, or Churg Strauss syndrome, or Churg Strauss syndrome, whatever you can say, all right? G for GERD, that is gastroesophageal reflux disease. Somebody says the GORD, all right, no problem. And P for, yes, Polyarteritis nodosa. And A stands on ABBA, sometimes I'm saying the ABBA, that is Allergic bronchopulmonary aspergillosis. So yes, this is a box. A little bit discussion further, it will be really helpful. So start with the box, there is the bronchial asthma. It's strongly associated with the CGPA, the mnemonics. Here's once again C for Churg Strauss syndrome, Z for GERD, and P for stands on the Polyarteritis nodosa, and also the A for Allergic bronchopulmonary aspergillosis. Yes, very important, all right. So bronchial asthma, strongly associated disorder are CGPA. So C for Churg Strauss syndrome, Z for GERD, P for Polyarteritis nodosa, and A for Allergic bronchopulmonary aspergillosis. I like to make a box, a little bit discussion. You see, Churg Strauss syndrome and also the Polyarteritis nodosa. We'll discuss in the chapter of rheumatology. You'll see we classify the vasculitis into the large vessel, then the medium vessel vasculitis, and also the small vessel vasculitis. So large vessel and also the medium vessel vasculitis is once again the medium sized pan, so Polyarteritis nodosa, and small vessel vasculitis also we are classifying into the C-ANCA and also the P-ANCA. And having this P-ANCA, the disease, the pan can be positive in P-ANCA, and you will see in the chapter of rheumatology the lectures on Polyarteritis nodosa. There is a pan lectures that you'll get there, and you'll see the details of the discussions of the pan and P-ANCA positivity. So what I'm saying is the diseases like the two vasculitis are strongly associated with the bronchial asthma, right? So another thing we can write in another box among this small box that will be helpful. So this is the bronchial asthma, strongly associated with the significant eosinophilia. I'm writing EO, that will be helpful. So yes, bronchial asthma strongly associated with the eosinophilia, the associated disorders. Yes, starting the first diagnosis, that should be the Churg Strauss syndrome. And second diagnosis, once again, that is the allergic bronchopulmonary aspergillosis. So making this box, my dear, it will be helpful. Raised eosinophilia count, all right? This is once again Churg Strauss Syndrome and also the Allergic bronchopulmonary aspergillosis. Now talk, right? I'd like to discuss about the Churg Strauss Syndrome. Once again, the Churg Strauss Syndrome, as I said, the small vessel Panca positive small vessel vasculitis. So let's see how Churg Strauss Syndrome, and also from these two boxes that you have concluded this bronchial asthma associated with the eosinophilia. The first diagnosis is the Churg Strauss Syndrome. Yes. So all the features can be remembered. The Churg Strauss Syndrome, a box of the Churg Strauss Syndrome, we can write a very important point. Then we can write the don't. We can write the don't charge. Yes. Me as Panca. We can write so that we can remember Panca and lol, all right. And mnemonic box, a sentence, how it is helpful. Let's see and talk about this Churg Strauss Syndrome. So once again, I'm writing, say with me, don't charge me as Panca. So what is that? The don't. I'm writing the don't, the red color, because this don't is really important. So don't charge me as Panca, and last word the lol. All right. So once again, what I'm saying, the Churg Strauss Syndrome is nothing but don't charge me as Panca. All right. So Priyanka Chopra is a very famous, actress in from the Bollywood. So that's I'm writing. All right. I'm definitely not the Priyanka, rather the Dr. Shumant, right? So that's why I put the lol word. Sometimes you used to write LOL, lol in Facebook, right? Some of the status, so it will be helpful. All right. A bit funny and enjoyable. Right, the mnemonics that will be helpful to remember all together all the features of Churg Strauss Syndrome. So say with me, Churg Strauss Syndrome is nothing but don't charge me as Panca. Yes, the lol. All right. So let's see how it is helpful, my dear. So once again, the charge word will be helpful to remember the Churg Strauss Syndrome. And how this me will be helpful. Let's see, the M stands on Mononeuritis multiplex, my dear. And E for, once again, the eosinophilia. I'm writing the way the EO arrow up. So that does mean the eosinophilia arrow up, right? As for the, yes, as stands on the asthma, all right? And Panca, right, the Panca, we can write the Panca, that is Panca positivity. And lol and don't, all right, I'm writing don't and the lol. So don't lol is all together. Just write it down, don't say lol, all right. What does it mean? The Churg Strauss Syndrome, the passions we shouldn't use, all right. Don't means don't use, the lol means leukotriene receptor antagonist or blockers, because the leukotriene receptor antagonist can precipitate the attacks of the bronchial asthma in a patient with the Churg Strauss Syndrome. So yes, let's do the mnemonics part, then I'll discuss a little bit more. Here's the Churg Strauss Syndrome, then the total mnemonics, all right. So once again, say with me, don't charge me the Churg Strauss Syndrome, then the me for Mononeuritis multiplex, E for eosinophilia, AS for asthma, all right. Next, the Priyanka Chopra, all right, Priyanka, no problem. Priyanka, I'm saying, and then don't lol, does it mean the don't use the lol, means the leukotriene receptor antagonist, all right. So this is a very, very important discussion, right? This is box once again. That will be helpful. So before going to this box, and the small box will be really helpful of as this box of the Churg Strauss Syndrome. What would happen in Churg Strauss Syndrome? It is said that the initial phase or the first phase of the Churg Strauss Syndrome, the patient usually come up with the diagnosis of the bronchial asthma, and they then pass the second phase. The second phase of this category of the patients come with the eosinophilic phase. We can write like that, and then third phase. All right, third phase, the patients usually passes through the vasculitic phase. So we can write the asthma phase. All right, and this is eosinophilic phase. We can write the eosinophilic phase, and this is vasculitic phase. So these are the phases usually the patients passes of the Churg Strauss Syndrome. All right, Churg Strauss Syndrome. Yes, you see the first phase, and the second phase, and the third phase. So once again, I'd like to say first phase is the asthma phase. First phase, what I said, the asthma phase. Second phase, the eosinophilic phase. Third phase, the vasculitic phase. And these vasculitis can come up, right? Can come up with sometimes can come up with the Mononeuritis, multiplex that you have written like here, you see. And they are positive for the Panca positivity, right, Churg Strauss Syndrome, and don't use the levotransceptor blockers, and these will be helpful. So this is a very, very important discussions, my dear. The first, second, and third boxes, all together the Churg Strauss Syndrome, it will be helpful. Yes, once again, I would like to summarize the first box, start with the bronchial asthma association CGPA, remember. And second box, once again, bronchial asthma with the eosinophilia. Here's the Churg Strauss Syndrome along with the ABBA, all right. Third phase, third box, once again, that is the Churg Strauss Syndrome is that don't charge me as Priyanka, lol, all right. And fourth box, once again, there is asthma phase, eosinophilic phase, and vasculitic phase. So once again, the summary. First box, start with the bronchial asthma association C. Okay. Second box, bronchial asthma with eosinophilia. That is a Churg Strauss Syndrome and also the ABBA. All right, we can write the bronchial asthma and eosinophilia. So yes, C and A, you can write the C. And here's once the third book says Churg Strauss Syndrome, don't charge me as Priyanka, lol. And last box is the first phase asthma, second phase eosinophilia, and third phase is the vasculitis. I hope that you enjoyed. Thank you. Thank you very much, my dear.